before we continue, I would want to request that the students who have the sponsorship, or those who got the sponsorship from the Africa One, I would need you to kindly step outside and then put down some details for us. Okay, so we need that information either now or, before you leave here. We need that information. Thank you very much. Also, we have the QR codes. There's one code, the QR code on sheets of paper. So you can just scan and then do your evaluation. Give us your feedback so we can improve upon this next year. So please try and do that. We also have them, I think, yes, they are also on the doors. Just scan and then you get the questionnaire. Yes. No, this is a different one. It was, yes, so these are not for the abstract. These are the new ones we have just put there for the evaluation. So please, as much as possible, please try and get that done for us. Thank you very much. All right, so for this afternoon session, the plenary session, the fourth plenary session, the last one for this conference, which is on health promotion, including sports and exercise with nutrition and hygiene. The chair for this function is past or former Pro Vice Chancellor, the former director for the Kintampo Health Research Center, Professor Seth Owusu Eje. So with a round of applause, shall we please welcome Prof to come and take the chair and steer us through this part of the program. Thank you very much.
So I'll crack a bit. It's not back yet. Okay. Well, thanks much, Fidelis. Observation, I think the numbers are dwindling very fast. We started with a bigger group. Probably some are still at lunch, but I think people will be running away. The committee members decided that I should chair this final one because they suspected that I will also disappear. So I'm here. But please don't treat me like that again next time. The first day, make sure that you grant me the opportunity, and then we will all be rolling on. Welcome, Prof. BC and the registrar. I was just saying that the committee members suspected that maybe I will run away. So they asked me to chair the last plenary session. So I'm here, I have no choice. The other terrible thing they did to me is that I was following the agenda as it is. So I've been seated here with the presenter since 1:30, just obedient children sitting here. As for this clap, dear, it's not enough. The clap is not enough. I was going to charge those who kept me sitting here for almost 1.5 hours. So you've clapped for me. Thank you very much. Thank you. Now, I'm cracking these jokes because I'm still looking for my keynote presenter. Is he coming? Okay. I'm sure by the time I finish saying a few things about him, he will be seated here. I think Prof. Amuna, you are just walking in. Okay, welcome. You should know him from previous conferences. He's been our dean of the Fred Binker School of Public Health, and I think ended somewhere last year. Is that right? Yes. So both he and I are retired. But because we are not tired yet, we are here to ginger you on. Well, Prof. Amuna, as we know him, has been very dynamic. He's going to talk to us on health promotion, dwelling on nutrition. In fact, that's his staunch area. And then hygiene. But he has been asked to add or include sports and exercise as part of it. Something I've been defaulting on. I know many others, including my moms who are seated in front here. Oh, you have been exercising? She's been. Okay. So my mom is defaulting and I'm defaulting. So hit us hard as you mount the presentation here. Since we're far behind, I will stop profiling him. If you go into the, you call it book of what, abstract book, you can read more about Paul. You are welcome. Take over and we'll listen to you.
Thank you very much, Prof. Oye, for your kind introduction. And I want to, first of all, thank the organizers for inviting me to be part of this conference. Vice Chancellor, distinguished guests, registrar, ladies and gentlemen. I think we've had 3 full days of exciting discussions around the theme of the conference, how we can actually make some transformations in our universal health coverage on the continent. We've heard from various speakers from the first day when there was a focus on research, integrity, ethics during the virtual conference. And then following that, we've had a number of presentations from distinguished speakers. So my job is to frame the subject around health promotion. And as was said by the chairman, it's a very broad area. And I'm going to try to do my best. I will not be going into a lot of detail on these topics, but I had some outline here. I'm just going to touch on the surface, given the time and the fact that we need to finish this conference in good time for people to travel. And so I wanted to give some kind of indication of the context and definitions of health promotion, and then to look at it within the Ghanaian population health context, to link it to the nutrition transition and NCDs. We heard from Dr. Bosu yesterday on NCDs, and then to look at some of the work that we have done ourselves, and so on and so forth. But I'm going to truncate this, and I'm going to focus on the headline issues because we don't have a lot of time. Anticipating that we might run into time issues, I thought I would give you my take-home message first, so that after this we can all go home. So the first take-home is that health promotion is complex, and we have heard it through all the presentations. We've sat in some of the breakaway sessions, and we've seen that it is complex, it is multifaceted, and it requires a multidisciplinary and a multi-sectoral approach, and involve individuals, families, communities, civil society, and policymakers to be effective and self-sustaining. We have heard during this conference about issues of implementation and the challenges associated with implementing policies, and we have had discussions around these. Research should be built around this understanding. Number two, in the Ghanaian context, the Ghana Demographic and Health Survey provides a lot of food for thought, but also opportunities to explore current gaps in our national health and development. There is a need for a multidisciplinary and targeted research in order to address our ongoing health challenges and in regards to our goal of ensuring that we provide universal health coverage. Thirdly, academics and researchers can influence public health and actions through evidence gathering and demonstration through translational and implementation research. And I see a lot of opportunity for that, having listened to certain sessions throughout this conference, having looked at some of the posters and seeing the richness of the work that people are doing at all levels, from undergraduate to postgraduate and beyond. And whilst progress has been made in reducing child and maternal mortality, and malaria elimination efforts are ongoing, more needs to be done, as I'm sure we all agree. Then there is urgent attention is needed to be placed on nutrition and chronic diseases. And I'm sure over the course of this conference, you have heard from various speakers which really reinforce this message. And that should be our target for the next phase of our efforts to fight for improved health and meeting the goals of the Sustainable Development Goals 2 and 3 in particular. And then finally, nutrition literacy and training in sports, nutrition, and research are needed to address continuing underperformance in sports and the fitness of the general population. I say this with a particular focus and interest on the School of Sports and Exercise Medicine at UHAS, which is one of the youngest schools and is trying to build and develop itself. There is a lot of opportunity for that school to be a leader in sports, nutrition, and sports-related research in Ghana. So, when we talk of health promotion, we know that historically, health promotion emerged from the early health education movement in the early 1900s. And the emphasis was on cleanliness, personal behavior, and responsibility for one's own health and well-being. So when we talk about WASH and all these other public health measures, which became so critically important during the recent COVID pandemic, then we appreciate the value of health promotion. But it has also evolved and is now more than a personal and population education. And so, for example, the World Health Organization has defined health promotion as the process of enabling people to increase control over and improve their health. There is a lot in this definition. And so I have colored some keywords to help us. And there are other definitions. For example, Tones and Tilford say that health promotion is equal to health education and times health policy, public health policy. And I know in my school we have wrestled with the issue between health promotion and health education, and I always laugh whenever I remember some of our arguments. So for the sake of this talk, I wanted to highlight two main models of health promotion and to use those to then help with the discourse. And I was interested in BT's model of health promotion and also Tones and Tilford's empowerment model of health promotion. I chose the latter because we see that health promotion goes beyond just individuals and just general issues, but also has issues relating to empowerment. And so if we take BT's model, basically there are two areas that we should think about: the authoritative and then the negotiated. Why is this important? Authoritative will include things like national policies, national directives, national regulations, requirements, and so on and so forth. And that is where the authoritative aspect comes from. And then we have the negotiated, where we are trying to reason with people, try to get their perspectives and to build their perspectives into any initiatives or interventions that we may actually have. And then, of course, at the end of the day, we are interested in individuals as well as the community. And so if you look at this model, there is the issue of health persuasion, legislative action, personal counseling, and community development. And that is where the empowerment model becomes very, very important. And so what I'm going to do is I'm going to just now look at some of the applications. So for example, there are two main axes of BT's model. One is the type of approach that we use. Is it going to be top-down or is it going to be bottom-up? And the second one is the size of the approach. How wide, how broad. And you note that we often start with, we test something, then we roll it out when it is working, and then it becomes a population-wide activity. So there are certain key things that I've mentioned already, and I'm not going to repeat them. And this is a Tolles and Co's model, which talks about empowerment, and we can read all about it. And I'm going to share my slides so people can look at this later on. So what are some of the recent examples of actions that we have taken in this country to influence public policy? Yesterday, when Dr. Bosu gave his presentation, he talked about some of the laws and the taxes that are meant to actually help to reduce NCDs. In particular, he talked about the sugar tax, which I have to say was the result of work that was done over years with the help of leaders in this field like Professor Amos La and the team at the University of Ghana and other universities, including people from UHAS, that actually worked with policymakers to arrive at the sugar tax, which is supposed to help to reduce NCDs. We've also had new policies we are working on. We are currently working on 4 policies relating to food labeling, marketing, and things like that with the Ministry of Health and the Food and Drug Administration. And academia is very much at the heart of all these things. We've also, last year, we had an advocacy for public health emergency funding, which UHAS partnered with Send Ghana and the Global Health Advocacy Incubator, and that is work that we need to carry forward and be leaders in. And of course, we are reminded of recent events involving protests around Galamsey, illegal mining, and how it is polluting our environment, our water bodies, affecting food quality, safety, and all the rest of it. So, in the context of health, what are some of the key things? I thought I should highlight a few things from Ghana's Demographic Health and Health Survey, and I was particularly interested in highlighting things to do with maternal and child health because that's an area of interest. But this is a list of the areas that the recent report has kind of highlighted. And these are trends in fertility by residents. And you can see that between 1988, and the pointer is not working, unfortunately. Between 1988 and 2022, we can see a drop in fertility rates. So there is a general trend downwards in fertility rates in Ghana. So the question is, why? And then we also have trends in early child mortality rates. Again, you can see that we have achieved some good numbers in terms of child mortality rates coming down. But the question is, why? And where are the gaps? And by the way, whilst we are at it and we are looking at average figures, let's note that in certain regions of the country, the rates are much higher than others. For example, if you take the stunting rates, in the northern parts of the country, stunting rates are as high as 27%, whereas the national average is around 17%. Why? So those are the questions. And the importance of those early life issues is based on the fact that we know from Barker's early work that nutrition programming exists. It is a biomedical and biochemical sort of a series of activities that take place in utero, and that is why the health and nutrition of the mother pre-pregnancy and throughout pregnancy are critical to the health and the aspirations and the future risks that the child that is born actually faces. And what Barker's hypothesis says in relation to the programming of function is that during early life, nutrient exposure sets metabolic behavior and thereby determines the risk of chronic diseases during adult life. And indeed, we have seen this when you look at this particular diagram here where, unfortunately, I cannot use the pointer, but pregnancy, when there is low weight of the mother in pregnancy, it has ramifications in terms of the pregnancy weight gain. Is it working? All right. Okay. Never mind. Yeah. So the weight gain in pregnancy becomes critical. And I remember as a student, there was emphasis by the obstetricians that the mother must gain at least 10 kilograms throughout the pregnancy. The reason is that the 10 kilograms is going to be divided between the baby the placenta, and the mother in terms of gaining weight, increase in blood volume, and so on and so forth. So that if the mother's overall weight in pregnancy is low, then it means that apportioning these various things will then end up in people having babies that are born that are low birth weight. And being low birth weight has a lot of ramifications here. You can see the low birth weight. So inadequate fetal nutrition during pregnancy will lead to low birth weight. And then when that baby is born, they need to catch up. But if during the early phase of breastfeeding, infant feeding, and growth and so on, they are not able to catch up well. And if the environmental influences in terms of hygiene, in terms of food safety, and all these other things, and then the infections and other things that the child is exposed to, and in our environment, malaria is one of them, then it will actually accelerate the problem of stunting, which then also will lead into problems in adolescence, and then there is a cycle that keeps repeating itself. So basically what this means is that we need to look at opportunities for health promotion along every step of the way in order to maximize the gains in terms of maternal and reproductive health. And again, this is trends in childhood vaccinations, and you can see from this figure that the level of people not having vaccination has dropped quite significantly, but then we still have some work to do in this area. So the question is, why are we getting a good and positive news, and where are the gaps, and what can we do in terms of health promotion? And finally, in this series of slides, we have trends in nutritional status of children under 5. And again, you can see the levels of stunting and other things have dropped. Wasting has come down significantly, but we still have work to do in terms of differentials. And we have also increased exclusive breastfeeding to 53%, but that is only about half. So the question is, why? And what are the opportunities for us to promote breastfeeding to help people so that we can all do well together? And of course, a lot has been said about malaria and IT, and I'm not going to spend more time on it. I just thought this was interesting to put in because in 2019, the survey suggested that 74% of us were using ITNs, and in 2022, the number has dropped. So I'm just flagging this as an area where we need to ask why and what can we do. So what is the context in terms of the nutrition transition? We know the non-communicable diseases in Ghana. We know the usual suspects, but some people don't even think of sickle cell disease and other inherited conditions as NCDs. They are. And then some people don't even know that injuries are part of NCDs. And of course, mental health issues are critical in this area. And we know there is a shift in our fortunes in terms of the infectious diseases dropping with our development. Mortality has come down. Forget about COVID. It is just an outlier. And then at the same time, non-communicable diseases have been going up. In fact, the focus of the World Health Organization and others before COVID in Africa was on non-communicable diseases. And so it was an aberration. But non-communicable diseases have been going up. And so we see that it is probably something we can say are diseases of development. These are some recent statistics from Ghana. I'm not going to belabor the point, except to say that we are told in the DHS data that 50% of women between 15 and 49 are either overweight or obese in Ghana. And I'm still trying to get my head around that. But the question is, why? And obesity is an environmental issue. The food environment, the general environment, the physical built environment. How many places in our roads in town can we actually walk because we have pavements? Fortunately, in Ho, it appears you have pavements in the center of town, which is fantastic, but certainly not in Hohoi. So the nutrition transition actually basically takes us through the journey from our time as hunter-gatherers to today. And the person behind this nutrition transition is Barry Popkin. He has been the leader in this field, and I was working independently, trying to crack my head around issues to do with our development, our early beginnings, and our risk of chronic disease. And then I chanced upon some of the work that Barry has been doing. And recently, we invited Barry to Cape Coast to the African Nutrition Conference, and he was one of our speakers there. We note that there is a relationship between the shifts from rural to urban living. And ladies and gentlemen, for those who don't know, the estimation is that by 2030, more of us will be living in urban than in rural areas. And what are the implications? What are the health promotion challenges that we are likely to face? And how do we address them? So some evidence from our work. I'll just touch briefly on this. This is work that we did in the United Kingdom. Swaji Saka, myself, we were interested to understand how migration can actually influence disease risk. And we wanted to understand how early life experiences in one country, people can actually travel with their disease risk in their suitcase. And so we were looking at Indians from the Punjab who had migrated to the UK, both first and second generation. And we focused on the males. And we found that in India, the overweight and obesity rates in the Punjab is about 30%. And in the UK, the average overweight and obesity rate was 63% at the time. Among the Punjabs who had migrated from India to the United Kingdom, rate of overweight and obesity among males was 90%. So why? Then we realized that in the Punjab, the majority, 70% plus, are involved in physical manual labor, mostly farm work. In the UK, the majority are in the service industry. And you can see clearly the differences there in terms of occupation. So ladies and gentlemen, just moving from one place to another with your disease risk in your suitcase. If you change jobs from being active, walking around and dancing to bobobo, and you go and you are sitting down for most of the time doing service-related work, your risk is going to increase. Health promotion. We found that their pattern of consumption, lunch was the most important meal. And you note that the supper is not as much as the lunch, and the breakfast was very little. The reason is that many of the people that we surveyed actually are in the service industry, and they work mostly at night. And so in the morning, they are asleep. And so the afternoon is almost like their breakfast. And these are some of the things that we were looking at. We wanted to find out about their use of various fats and so on. We found that their body mass index, again, we looked at the first generation and the second generation. And you can see the body mass index is quite high. The pointer is working here, but not on the screen for some reason. Anyway, so they had high BMI. And we also noticed that their systolic blood pressures and diastolic blood pressures were higher on the higher side, the pre-hypertension side. And we found that their level of physical activity was low. Ladies and gentlemen, the cutoff for physical activity is 1.54 for sedentary. And you can see from this graph that both first and second generations were largely sedentary. And all these together were contributing to the picture that we're beginning to see. We also have results of blood sugar, fasting blood sugar, and other things which I'm not showing. We found that their waist and their hip circumferences were also higher than the expected values. You can see the red line, and you can see our. And then when we looked at where they are in terms of the nutrition transition, we found that high intake of saturated fatty acids, high levels of cholesterol, low intake of fiber, and a very high intakes of sugar. And as I said, the blood pressure was going up, glucose was up, waist circumference, BMI. Basically, all the ingredients for non-communicable disease were there. Remember that many of the nutrition-related non-communicable diseases tend to travel together. And so all you need is to have the exposure. Their level of physical activity was low, and they were living a sedentary lifestyle with positive energy balance. These are all recipes for the problems that we saw. So, how do we talk about this in relation to sport and exercise? Now, first of all, we want to maximize performance among our trained athletes. We also want to make sure that the general public has a good level of physical activity, and we usually recommend that up to 150 hours of some level of physical activity. It doesn't matter whether it is low, moderate, or high. We prefer that it is at least moderate, but 150 hours. Believe you me, many of us don't do 150 hours a week, not a day. We don't do it. And 150 hours is how many hours? How many days? Anyway. So there is poor attention around nutrition for very active people, sports people. There is also not much in respect of the general population. So we have a problem. I'm not surprised that the Ghana football and other teams don't do so well. It's not the coach. And then there are dietary fuels, carbohydrates, proteins. We need all those. This is just to show you some of the science in terms of how much energy we derive from different fuels that we use in exercise. And I put this slide in just to show to you, ladies and gentlemen, that if you want, as they say, if you want to go far, then you go with other people. If you want to go too fast, then you have problems. For sprints, usually lasting up to 60 seconds, you don't need a lot of oxygen. But if you want to burn body fat, you need to do exercises that will burn fat, and that will require oxygen. Because without oxygen, we cannot burn our body fat. So you need to choose exercises that actually enable you to use the fat while you are exercising. Many people get up and they say they are going to do aerobics, and they don't understand what it means. Anyway, we can talk about this. And I put this in just to show you that, just to bluff a little bit, there is science behind it. But we will not go into the details of that. And I also put this in to let you know that there are biochemical markers that we can actually use to determine how things are going. Ladies and gentlemen, insulin is very important. And there are various membrane receptors for insulin. And there is a non-insulin regulated, the sports person, they become very tired easily. Training is a chore, and their judgment is impaired, and so on. I put this in just to show the importance of sports nutrition. And so for those of us working in sports and exercise medicine, please note that there's a lot of scope for work to be done and research in this area. And then, of course, there's the issue of protein supplements, whether we should have supplements or not, who should have supplements, and when. Athletes, different types, it's very important. And then, of course, we have the minerals and the vitamins. Should we be taking mineral and vitamin supplements if we have an adequate diet, for example, and so on? So there are a whole lot of things. Hydration is critical. Critical. I collapsed in this very on this very campus a few years ago, and the reason was that I was severely dehydrated. That was why I collapsed. And so this is a paper that I thought I'll throw in just to show you some of the early work that we did. I have been working in sports and exercise medicine and nutrition for quite some time. In Ghana, I have not done a lot, but in the UK, I was very much involved in this. And Liam Kilduff, who was co-author for this paper, which has been highly cited, Liam was an undergraduate student of ours. And today he's a professor of sports science at University of Wales. And we did this work together with Yannis Pissiladis, my good friend. And it is one of the papers that has been cited a lot on this subject. And it's actually been referred to quite a number of books as well. So we are quite proud of this work. So there are opportunities for research in sports nutrition. And so how do we address issues of health promotion in relation to Ghana? I think I will focus on this, and after that, I can bring it to a close, and then we can have some discussion. Ghana launched its first national food-based dietary guidelines. Since we are talking about health promotion, I thought I should bring this into the discussion, because I have seen people ask questions in this room. I'm not going to ask a question for people to raise their hands. I just want us to know that we have national food-based dietary guidelines in Ghana. For those who don't know about this, it is very important that we know about it. It was launched. There are ways in which these things are produced, and basically we should know about portion sizes, serving sizes, and all these things. But I always say that a good balanced diet is good. However, too much of everything, however good, is bad. And that is health promotion. This was when the food-based dietary guidelines was being launched. And you can see my good friend, Professor Analate, who is a leader in nutrition, well-renowned. And recently we awarded her the Scrimshaw Award for Excellence in Nutrition. And Dr. Kasolo there, who was the regional rep for. And this is Professor Richmond Aite, who led a lot of the work on the food-based dietary guideline. We've been going on a road show around the country, having public engagements to actually educate people on the food-based dietary guidelines. So we've been doing that, just to bring this to. And these are the recommendations from the food-based dietary guidelines. I've summarized them here. There are 13 of them. So eat a diverse and varied diet from 6 food groups. Eat a variety of fruits every day. Eat a variety of vegetables every day. Eat a variety of legumes, pulses, and nuts every day. Eat a variety of animal source foods. Healthy fats, oils, and oily seeds in moderation. And recently, my boss, Fred Binka, has sent me some. Whenever he sees something on oil, say, look, these, how do you call it, margarines and all these things, he'll send it to me and say, look, you have to tell them to stop eating these things. And then, of course, unpolished rice and other grains. And then the complementary recommendations are on foods and ingredients that are high in sugar and fat, those sugar-sweetened beverages. And then for us to be physically active, that is not food, but it is medicine in the sense that it helps us to burn the food that we eat. And then real food, read food labels and nutrition information. As I said, we are currently working on new food label policy, which will be out one of these days. And it's work that we are very proud of. And we should keep food safely and eat safe food. And that brings me to the issue of food safety and hygiene, which hopefully we can talk about some other time. And then last but not least, we should take alcohol in moderation, if at all. And we should drink water regularly. And I keep telling people, water is good for our kidneys. Water is good for our kidneys. On that note, I think I'll bring this to an end because I have quite a lot of other things, but I'll rather leave it at this point. Thank you very much.
Well, thanks very much. Sorry, we have to truncate you so that we can bring this session to a close. I'm looking forward to nobody asking a question. Are you in support? Who is totally agitated, cannot reserve the question to talk to Professor Muna, maybe on the quiet after we are done. If you raise your hand, it will become a flagpole. It means it will hang in the air forever. Just say amen to that. I think Prof. VC has other burning event and cannot be here for any longer. So please, permit me. I was going to ask my own questions, but I've reserved it, so you to reserve yours, so that we can bring this session to a close and then finish off. Otherwise, we will lose VC and registrar being part of the closing ceremony. Where are we? Do we want to ask questions, or we want VC to participate in the closing? Who is talking? You see, this is not parliament. Even Ghana parliament is hanging. So on this note, flagpole, I've told you already. I will bring this session to an end, and then thank Prof. Amuna very much for such a delicious delivery, and then hand over to the organizers so that we can finish off. Thank you very much. Thank you.
Thank you very much, Professor Muna and Professor Seto Usweje. So please, once again, the announcement I made regarding the Afric One beneficiaries, please, the people are down there. Okay, they are up here, so you can get to them to put in your information. Thank you very much. So we are immediately going into our closing ceremony. And so I'll just want to welcome all of you informally, actually, to this closing ceremony. And to do that, I would call on our registrar, Ms. Ya Amankwa Puni, to give us the welcome address. Shall we welcome her with a round of applause?
Thank you very much, MC. Madam Vice Chancellor, the Acting Director of the Institute of Health Research, the former director, deans, directors, audience, all too soon, this event is nearing to a close. We were here from 29th, go to this wonderful 2024 UHAS conference with a theme, Transforming Health Systems to Achieve Universal Health Coverage in Africa. We had 8 sub-themes, very beautiful plenary sessions and presentations. We've really had a wonderful time. And yesterday evening was quite relaxing when we did some twisting of the waist, and we had some beautiful slogans for the University of Health and Allied Sciences, even though the judges were biased. And because of that, we are not going to say the slogan here today. I have vetoed. And so thank you very much for coming to our Oxygen City and coming to this university for this conference. We look forward to seeing you again. I welcome you to the City Auditorium for the closing session of this conference. And I know that you are carrying away beautiful memories, great network, and knowledge and insight into various themes about health systems in Africa, away to wherever you came from. On this note, I welcome you to this evening's closing ceremony. Thank you very much.
Thank you very much, Madam Registrar. Okay. So thank you very much. So next on the program, we would have the chair of the planning committee, Professor Margaret Japon, to please come and then give us some remarks. Shall we welcome her with a round of applause? Professor Margaret Japon, the chair of the planning committee.
Thank you very much. I'm going to do this as quickly as I can. I've titled it Our Reflections. So we started on Monday with a virtual webinar. We had about 80 registered participants on and off. The feedback we get is that we must repeat this and take our time to go through the various sessions again. So it's going to fit in within the slots of the UHAS technical meeting series, and we'll share the link with all of you. It's usually a UHAS thing, but we'll open it up so that everybody would have an opportunity to listen. We were honored to have our partners with us, the Vice Chancellor of Ho Technical University. He told us his childhood story and encouraged all of us to pay attention to our health and to live healthy lives. And our regional director also joined us and spoke passionately about health. Our VC welcomed us warmly, and she was very excited about the fact that several people from different countries were here. She encouraged us to work hard, make beautiful presentations, and visit Ho. And she almost forgot some people, but she mentioned them, and they were very excited about it. Then we had our keynote, Professor Dorothy Yeboah-Menu. She spoke a lot about universal health coverage. But one of the things that hit me with what she said was the fact that there's a need for us to look at health and disease from a transdisciplinary lens. Because diseases that reside in human beings reside in human beings, and human beings belong to a society. They have cultural, they have religious, they have all kinds of aspects to them. And so we should not just look at it in one siloed way. And we can bring partners together to help us deal with a particular issue. And she used Buruli ulcer as an example, how through that we were able to understand various things. And she says, if we use that approach, we'll be able to achieve universal health coverage in Africa. Then we had Sunday, who was supposed to be talking about communicable diseases, malaria, NTD, but he also touched on universal health coverage and talked about the need for us to transform our health system, talked about integration, talked about maximizing our synergy and doing everything that we can to strengthen the health system so that we'll be able to deal with the diseases that we are talking about, malaria, NTDs, HIV, and AIDS, because we've set ourselves targets, and it looks like we are not too quick at reaching those targets. Javier's topic was stop wasting the data, and there was a call to action. He said we have to pay attention to the data that we collect. We must make sure that we conduct a number of systematic reviews and other reviews to be able to support health policy and program implementation. Then we also had Edem, who really walked us on an interesting journey, talking about the fact that there's the need for us to pay attention to the direction in which we are going with digitalization. And I like this quote. He said, "The highway is what you get once the path is very clear. Speed becomes essential and the obstacles can no longer be tolerated. Africa is poised, but are our leaders ready? A lot of capacity has been built in African scientists. We can do a lot of things, but we need the support. Those obstacles should not prevent us from moving forward, but we need our leaders to support us to make sure that this happens." Dr. Bosu presented a rather grim picture about NCDs today. Africa is not making much progress, but it will take all of us to be able to put in the effort to ensure that we meet the goals that we have set for ourselves. Of course, who can forget the pantalon of Moriba? If you forget anything at all about this conference, don't forget the pantalon. Where Moriba was going for a function, he had sewn his pantalon. The night before, he found out that it was too long, and then he needed it to be cut. The family discussed it. Every family member went and cut a piece, and then the pantalon became too short. What we are saying is that we should work together. We should communicate with each other. Ensure that the message is clear so that we don't make this kind of mistakes. One Health is complex, and it needs multiple approaches to be able to deal with this complex problem. So apart from all the speeches and talks that we had, the poster sessions were engaging. People were there listening to wonderful presentations and beautiful posters. The concurrent sessions were fantastic. Our students are something else, I don't know, but the confidence that they have to present. Sometimes I felt that maybe the level at which they were going was too high, undergraduate students, but they were confident in whatever they were doing, and all the presentations were exciting. If we had more time, we would have gone on and on. But we needed to energize. Paul just talked about food, so there was a lot of good food happening, and you could see the enthusiasm with which people were eating. But it was a good break for all of us. We received quite a lot of sponsorship in kind and in cash. So we had the mess equipment group, we had Nestle Ghana, we had Ghana Health Service, we had Ghana Water Company, and of course, we had One Health. If you were not in One Health, then sorry for you. They've been roaming around the place and showing off their scarves. And I know that something great is going to come out of this One Health family that we are forming in UHAS. Of course, on the first day, I talked about the CMS Foundation, and I didn't mention the name, but it was led by Dr. Maunyo Oyote, the pointer is not working. But she's the little one in the middle there. And she really has supported 5 students, and there they are, their registration and their accommodation to be able to attend the meeting. Let's give her. Where is she? Dr. Ayotte, where are you? Oh, stand up and let's give you a clap. Stand up, stand up, stand up, stand up. You see, she has been quiet. Prof. Basiru is all over and everybody is grabbing him. Everybody knows him. But you can stand up in case somebody doesn't know who you are. And then is Aisha here. Aisha, stand up, stand up, stand up. Aisha was a medical student last year. She qualified. She's doing her house job right now. She got a foundation together. She was one of the early ones who belonged to our Students Research Club. She formed this foundation. Last year, she supported 6 people. This year, it is 8. Let's clap for Aisha. And then once again, we clap for the most represented group in this place, the School of Public Health. And then if we take the outsiders, the most represented Kintampo Health Research Center. So maybe next year, awarding group, our assessment group, we give a prize for the most represented group here so that they will also go happy and it will push others to be able to come here. I want to thank the university management, faculty, and staff, the Institute of Health Research, the organizing committee, our international panel of reviewers. You were wonderful. Our panel of assessors, our rapporteurs, they were sitting quietly, but they were doing a lot of work. Our keynote speaker and all our plenary speakers, all of you participants and invited guests. The media, they are not here this evening, they were here this morning. I want to thank you all very much and leave you with this. Where's the volume? This young man, I begged him to dance, and then when he decided to dance, where is he? Oh, where's the volume? Okay, but this is the fun we had yesterday. Thank you very much, and have a safe journey back home.
All right, thank you very much, Professor Margaret Japon. So that was from the chair of the planning committee. The next item now is about our awards. You know, as you were presenting and everything, there were people around and assessing you and all that. So we want to see what the outcome is. So I would invite Professor Evelyn Ansah to take us through that.
Thank you very much. We want to thank all of you for your contribution in the various sessions. But before I start, I want to acknowledge a group of people who didn't get to sit in any of the sessions because they were busily at the back end compiling the awards, stepping in when assessors did not come, and doing all the work unseen. I want to acknowledge you. Can you rise so that we give you a clap? So these are the people who were working in the background, the team I was working with. And I also want to acknowledge the immense team of assessors who went around all the posters, sat in presentations. They really didn't want to sit in, but because we had assigned them, they went to sit in those places to assess and compile the marks. And I would like to explain that every presentation was assessed by at least 3 people. And so it was not one person. All this was had been programmed. So it was a link. Once you do it, you submit. It goes into the database. They are sitting at the back end looking at everything. I also want to acknowledge Emmanuel, all the way from UK, who was supporting us with it. He used to be here supporting us. And Emmanuel, if you are listening, thank you very much for the immense ICT support to our team. So now to the awards. So what we have is the first and second runner-ups for each category. We have 4 categories. We have the best poster presentations for the young investigators, and then the best oral presentations also for the young investigators. And then we have the overall best poster presentation, overall best oral presentation. And for each of the categories, we have the second runner-up and the first runner-up. So for the second and first runner-up, in the interest of time, we will ask you to rise where you are and we give you a clap. We will send you your certificate afterwards. But the plaques will go to the overall best. So we have 4 plaques, which we will be giving out. And Fidelis, if you, they have written on it. Yes, so you kind of remove it, but be sure of which one it is. Okay, so let me start. So for the second runner-up, young investigator category, the winner was Mr. Hamza Salifu Alemia with the topic that he had there with 40 marks. Thank you very much. Congratulations. You will receive your certificate for this. Okay, so thank you. Then the first runner-up was Miss Emanuela Elom Latte. Where's Emanuela? So congratulations, Emanuela. And before I continue, I want to say that the team that worked on it, the downside for them is that some of them would have won. The team I was working with, but they were assessed very highly, and they would have won some of these categories, but because of conflict of interest, we took them out. And so I'm sorry, this team, we agreed and we took them out. We all agreed that it will seem like a conflict of interest. So we will have to see how to do this the next time so they don't miss out, because some of them scored very highly, but we took them out. So just for you to know. So the overall, with regards to the overall best poster presentation, young investigator category, Miss Priscilla Esando. Let's clap her down. And Prof. Amuna. So we'll ask Prof. Amuna to come and give this award. She's so happy. Miss Priscilla Esando. And she gets a beautiful plaque. Let's clap for her. Thank you very much. Congratulations. And thank you, Prof. Amuna. So, thank you. So now we go to the young investigators' oral presentation. The second runner-up was Miss Priscilla Akununa Doche. Will you rise so that we clap for you? So that's our second runner-up. Then the first runner-up was Dr. Marie Bafo Bonnie. Congratulations, Dr. Bafo Bonnie. Congratulations, with 60 marks. And then the overall for the best oral presentation young investigator category was Miss Dinah Efia every year, Boafo. Her topic was exploring the influence of social media on dietary choices and body image perception among female tertiary students in Hohoe municipality. Let's clap for her. And we will have Professor Osweji to do us the honors. Let's clap for her. She's done a lot of work. Congratulations. Thank you, Professor Usweji. So we go to the next category, which is the senior people. So the second runner-up for the best poster presentation was Miss Grace Menu with 39.3 marks. Miss Menu, where are you? Congratulations, congratulations. And then we have the first runner-up, Dr. Frank Obeng, with 39.8 marks. Congratulations, congratulations. So then the overall best poster presentation went to Miss Mavis Pell Pavla. Factors influencing treatment defaults among tuberculosis patients at Hohoe municipality. Congrats. So it's Dr. Mavis Pell Kwabla. We'll change it, yes. So we will have Madam Registrar do us the honors. Congratulations, Mavis. Congratulations. Okay, so we go to the next category. VC, please, will you do us the honors for this last one? Okay, so we will do the runner-ups first whilst VC is coming up. So the second runner-up for this category, overall best oral presentation, is Dr. Edu Apia Kubi. Is he here? Oh, he's not here. Okay. And then the first runner-up was Dr. Hubert Amu. Congratulations, Dr. Amu. So the overall best oral presentation for this conference is Miss Deborah Adiki Anite. She's not here. Oh, she's not here. She doesn't have faith at all. Okay, VC. So somebody should receive it on her behalf. That was one of the things we couldn't pick up. But this looks like SARS, isn't it? SARS, yes. You receive it for her. That's a bamboo one, yes.
I was so excited.
You are excited. You were excited about it. Okay, so congratulations, Miss Deborah Adiki Anite. It's unfortunate you weren't here to collect your prize, but this is the overall best oral presentation. So we want to thank you very much once again. Thank you very much. Thank you.
All right, thank you very much, and congratulations to all of us, particularly who won the awards. So I would now invite the Vice Chancellor to. Oh, yeah, sorry. So please, shall we, with a round of applause, welcome our Vice Chancellor.
Thank you very much. I thought Prof. Wabin would speak before I speak, so she said I should speak first. Good evening. Oh, good evening. I was telling registrar that the program was too packed. So I can see that people are tired, their brains are saturated. But we thank God that it's finally over. I've engaged a few of you behind the scenes, and the general feedback is that it's overwhelming, it's very, very beneficial, it's engaging, and all that. But I know that relationships that were started some years back is being deepened and strengthened. I also know that new partnerships and friendships and relationships have been formed for the past 3 days. But as a university, we are committed to this annual research conference. We are committed to expand it. This January, we're going to introduce new graduate programs. Like I said 3 days ago, we have to ensure that our graduate students, master's and doctoral students, take this conference as a compulsory activity for the university. I'm also looking forward to more sponsorships for students, especially for students who are on projects. This should be compulsory, and every grant, I'm recommending the fact that we need to add conference item, not only international, but a conference like this is worth supporting students to come. Again, yes, we are coming to the Volta region, we are coming to Ghana, we are coming to the oxygen city of the country, but there should be an online version. So we should continue to have a technology-driven conference so that everybody can join wherever we are in the country. For example, I may register, but at the very point of the face-to-face, I'm traveling. Shouldn't I be able to join and present? We have already started a discussion of a peer review journal. The feedback I received yesterday at the program, some people said that the findings shared are worth publishing. Now, after the conference, like the way we had a pre-conference event, we could say in a week or two, per the feedback you have received at the conference, a post-conference event for developing capacity for the participants to be able to write and publish. And if we are able to roll out our peer review journal, it will be a good platform to share the knowledge with the rest of the world. As a university, we are not taking it for granted that you made time to be with us, especially our international guests. We are not taking it for granted that you left your country and all that you are doing to be here. We appreciate all of you that traveled far and near to the university. And then our research centers participants, Dodowa, Kintampo, Navrongo. Is there a fourth one? I don't think so. We are very grateful. And like I met you yesterday, we are looking for more to happen between us because we already signed the MOU to work together. And to the UHAS family, I know that somebody may give a closing vote of thanks, whatever you call it. But I am very, very happy that the numbers keep improving and increasing. Sandwich is ongoing. Some of you are teaching, but you made time and you are here. And I want you to come along with your students, your collaborators, your partners as much as possible. I saw the administrator of the whole teaching hospital here on the day of the opening ceremony. I'm also looking forward to not only the international partners, but the partnership within the Ghana Health Service, Ministry of Health, a teaching hospital fraternity, so that we can have a track for the clinicians also, and also acknowledge them the way we acknowledge the Hohoi. We should acknowledge the next year, those from the hospitals also, because evidence-based practice is now the order of the day. Before I leave the podium, is also to say that I think I said this on Tuesday, and I want to say it again. Normally, when you retire, you rest a little, you slow down a little, you take a breather. But I want to commend our chair for the conference again, because it is not easy. It is not easy. I want to commend Professor Margaret Japon again. What happened yesterday was something that I was really surprised. This is going to happen. But overnight, I said, did you plan, did you budget for it? But it happened. So Prof. MG, we are, as a university, we are grateful. Not me as Lydia Ziato, but as a university, we are very grateful. And all the people who are working behind the scenes. If I want to mention names, I'll leave some people. But because you are the leader of the conference, my appreciation goes through you to your members. And then the acting head of the institute, we appreciate all the commitment. So I'm leaving this podium saying that I want to see all of you again next year. Bring a friend. Should I say the slogan? It's in error, eh? Should I say it? It's totally wrong. It's grammatically, it's supposed to be you have, not you has. Okay. Registrar said the grammar is not correct, so I will say it. We wish you safe journey, safe flights, those who are flying, those who are going by road. We pray divine grace for all of you. We pray good health. As we are entering the election year, please, please, whatever you have to do to bring down a temper, to encourage somebody, whatever you have to do to let somebody sleep, please, we are health professionals and we can do it better. Let's ensure peace within our electoral area. Let's ensure peace in this December 7 polls. It is the first time a past president is seeking a comeback. It is the first time a vice president is seeking to continue 8 plus whatever. So it is a little some way, and we all have a role to play to ensure the peace. Thank you very much, and God bless us all.
Thank you, Vice Chancellor. I would call on Professor Boabin, the Acting Director of the Institute of Health Research, to please come and tell us what next. Shall we welcome him, please?
Thank you very much, Fidelis, Vice Chancellor. So my work is very simple, the next steps. So no doubt this has been a wonderful, it's been a very, very great conference. You know, the networks, the collaborations, you know, and even the thoughts that we have had for future research. So it's been a great. So I think Another round of applause and a round of applause and a big one to the chair of the conference planning committee and all the committee members. And already, through this, we have been able to, we have been successful in getting a workshop to be run for all the students in the final years of their study and also the graduate students. The resource person who came from the Africa CDC, Dr. Edem, has agreed. So that's the first next step. He's agreed to run a workshop on AI, digital systems, and digital solutions for health, in our local context, in Africa, and in the global context. So let's give a round of applause also for that. So this workshop is going to be run, for the students of UHAS. And secondly, he has also agreed to run a workshop for the staff. In fact, he was supposed to lead one of the technical sections, UHAS technical sections, which is coordinated by IHR. So he has agreed to also have a section, for us also, the staff, so that we are not left out. So that is one of the earlier programs which is actually going to come after this conference. And then also we have noticed that, through the interactions and all of that, conference participants have actually learned to engage in cross-discipline and multi-sectoral research, which is really very good. So we believe that at our next conference, we're going to see a lot more people working together, in collaboration, working across schools, institutes, etc., etc. So we see a lot more work and presentations in that area. So also the next conference, we know is going to be much more exciting, maybe more exciting than this one. So next steps, we are starting the planning of the next conference from tomorrow. I thought you were going to clap to that. We have learned from all the gaps. I mean, it's been a very packed conference and all of we know. And we also have had some feedback, so we are going to learn from all of that and we'll do our best to improve on that. And I know some discussions have gone on behind the scenes because of how this year's conference have been successful and because of the varied participants that we have had, all over. We want to give the next conference a West African or an African appeal. Do you agree with me? All right. So we're going to give the next conference a West African appeal. And, so we're going to have maybe much more of our partners, from the sub-region come. Because here we have Professor Basili Boru, is it Basili? Right, Bonful. Okay, in the group from La Côte d'Ivoire, we have participants from Nigeria. We also have participants from Togo, and of course, we have participants from all the schools in UHAS, and all of that. So we're going to give it a West African appeal. And once we are successful in doing that in grand style, going to start from UHAS, hopefully in future, we'll be going to the other African. So the UHAS Health Research Conference, which started, is going to take a form of West Africa Health Research Conference, with the first one being held in UHAS, and they will start rotating from the other West African, countries. So on that note, we want to encourage, all the schools and the research institutions to start working on their research and plan to enrich the discussions at the next conference. We know that, next conference, you're really going to present, great research work and research output. And also, we are looking for more sponsorship. So if you know anybody, who is willing and able and want to sponsor, we'll be very happy, you can just contact us and give us the contact. We are going to contact the person, because as for the next conference, it's going to be big. I've told you the planning is going to start from this year. So these are the next steps, which is actually coming out from this conference. And we thank you all for your participation. It's been a great conference, and we hope to see you at the next conference. Thank you very much.
Thank you very much, Prof. Babin. Please observe the following announcements. The first one is that I think from yesterday we had a list out there for registration for professional CPD. If you've not done that, they are still out there. Please do it before you go. Medical and Dental Council, Nursing and Midwifery Council, and then the Allied Health Professionals Council. The list is there. Please ensure that your name is there. But we'll cross-check with your attendance and registration and everything before we send the names. The other announcement is that please, the barcode is still there for the evaluation. If you've not done the evaluation yet, please do it. We still have the sheets on the doors, and we sent out some sheets as well whilst we were in the room. So please give us a feedback so that we can improve upon this. Thank you very much. So I've been asked to just conclude everything with a vote of thanks. And so, ladies and gentlemen, Vice Chancellor, Registrar, all protocol observed, as we draw this enlightening conference to a close, it is my privilege to deliver the vote of thanks on behalf of management and staff of the University of Health and Allied Sciences. We would first and foremost like to extend our gratitude to God for making this possible. Secondly, we would like to express our heartfelt appreciation to our keynote speakers for their invaluable insights and thoughtful and provoking presentations. In fact, your expertise has not only enriched our understanding, but has also inspired us to think critically about transforming health systems and achieving universal health coverage in Africa. Thank you so much for sharing your time and knowledge with all of us. I would also like to express our appreciation to all the presenters and all the session moderators. You facilitated an engaging discussion throughout the conference from day one till now. Thank you so much. Shall we give ourselves a clap for being very active in this? Your contributions have really fostered an environment of collaboration and learning that is really encouraged all of us as participants to share our perspectives and experiences. A special thanks also goes to the organizing committee and all volunteers who worked tirelessly behind the scenes to ensure the smooth running of this conference. We say a very big thank you to all of you. Your dedication and hard work has never gone unnoticed. Thank you so much for everything. To all of us participants, thank you for your active engagement and enthusiasm. Lastly, we would like to once again acknowledge our sponsors and partners: Top Up Pharmacy, Semis Foundation, Afric One, Health Research Nexus, MES Equipment, Ghana Water Limited, Nestle Ghana Limited, and Ghana Health Service. Thank you so much for your sponsor. Shall we give them a wonderful round of applause? And we ask for more. As we come next year, we ask you to continue to support us and even lead us to other sponsors that we can increase this. As we conclude, let us take the knowledge that we have gained here back to our communities, to our societies, to our institutions. And thank you all once again for being part of this conference. Safe travels home, and we look forward to seeing everyone here next year. Thank you very much. Before we leave, we would say the closing prayer, and so I would call on Reverend Professor Evelyn Ansah to please lead us with the closing prayer.
Okay, so shall we pray? We'll sing a little song, short. We thank you, Lord. We thank you, Lord. We thank you, Jehovah Almighty. Almighty. We thank you, Lord. We thank you, Lord. We thank you, Jehovah Almighty. Our dear Lord and Father, it will be amiss of us if we do not come to you and say thank you. We say thank you for how you have guided this conference through these 3 days, how you have given journey mercies. Many people traveled from far and near. You brought them safely and you are taking them back safely. We thank you, O God, that throughout these days there has been good health for every participant, every moderator. We have had no incidents, no accidents, and we can only say thank you. We thank you, oh God, for your faithfulness and for your mercies towards us. And now, as we journey back to our various places, we commit every participant, every into your hands, that you preserve and keep each one of us until we arrive safely in our various places. And we will be careful to give you the praise and the glory in the matchless name of Jesus Christ, your Son, have we prayed. And all the people say, Amen. Amen. God bless us all.
All those from SPH, UHAS SPH, please. I'm told you are meeting right here, so you can please come down this way. SPH.